Sure. So RETAIN-1 was a trial of neoadjuvant chemotherapy, and then for patients who had a clinical complete response and a biomarker suggested complete response, they were allowed to go on active surveillance, and those who did not had an intervention, radiation or surgery, usually surgery. We showed that we sort of met the mark for 2-year metastasis-free survival compared to historical controls, yet in that study, not every patient had to have a cystectomy, and there's a nice proportion of patients who have an intact, unirradiated bladder, which is a great outcome for those folks. For RETAIN-2, we did the same thing. Dr. Pooja Gatalia is the PI of that. She presented it yesterday at the orals. We added nivolumab to the dose densembec. That was the only difference. And we actually surprised ourselves with how good the results were in terms of pathologic complete response in the group that did go to cystectomy. Remember, the group we expect to not have a PT0 was 40%. And then the longer term outcome, 2-year metastasis-free survival, is hovering up around 85%, which we haven't seen before. So we think that bladder preservation is here to stay. It's feasible, it's safe. I think we think that dose densembec is probably the right backbone for adding immunotherapy in the neoadjuvant space. And things to explore further include maintenance, not exactly adjuvant, but maintenance immunotherapy for those groups and folks in active surveillance to kind of maximize the response to IO, which is where we think the durability comes from.